Okay, this is one of our amazing scoliosis patients that, mind if I say your name?
Yeah.
Okay. So this is Javier. Javier has a pretty good scoliosis curve that you can see a few things. So come in here a little bit closer here, Shar. And so this redness is actually from Shar. She beat him up a little bit today. But Javier has a curve that comes down, goes to the right, and then goes to the left. You can see how the muscle is more back here, and his shoulder blade pushes back a little bit too. He also has a little bit of what we call kyphosis, or the rounding of the upper back. So I want to show you kind of the principles of the Schroth method in how we work with Javier's back, because you can see his curve pretty well, and Javier does really good with corrections. So basically, the Schroth method is meant to take the spine from where it is and put it back more towards midline. So if we think about that with Javier, we have this side that's back too far, this side that's back too far, this is concave, so it's in too far, this side is out too far, and then just in too far here, forward too much. So we try to take all those and we try to bring it back to the midline. So I'm going to show you how we do that with Javier's back. So Javier, put your hands up on your shoulders. So first of all, we have Javier get a little bit taller, so he's more elongated. He's going to lean forward a little bit. So we get these muscles activated. And we already see that kyphosis kind of went down a bit. So now we take this by the shoulder blade, which is back too far and out too far, and we're pushing that forward, and we push that inward. I want him to stay over his pelvis. Perfect. And he's pushing out at the elbows just to control this block. So push in here a little more, Javier, and forward. Don't let your shoulder blade do it. There we go. So that looks awesome. Now we're going to do the same thing down here. We're going to push inward on this prominence. This is a little harder. Push out here. There you go. In and forward to put that block back where we want it. And now we're going to expand the concavity outward and backward. A little more outward. Good. Inward here. Keep this in and forward. Expand outward here and backward. Lean forward just a little. Expand here even more. Bring that back right there on that rib. Keep this forward. Good. Push in here. Breathe and expand. Good. So Javier is a pro at this. He's done really well with this. So keep that. I need to grab a pole. Keep going. Keep elongating. Hold on to that. Okay, lean forward a little bit. Now push that pole into the ground. Then we see that really go outward. We see that go inward, elbow forward, keeping that in, and this tension in. Perfect. Shoulder blade, let it go out. Perfect. So basically we're trying to take everything where we don't want it, put it back where we want it. Go ahead and relax. Javier works hard on this one. So then we see the imbalances go back to where they were. So the idea is to do that more and retrain the muscles so that the muscles do that more automatically. So thanks, Javier. Good work. Thanks for watching, and feel free to subscribe.